When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to activate or release the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
Great. So we think a lot, if you think about humanitarian response, for example, what does protection mean? What is international protection? You think of the UN and the flags and whatever, and that's an important form of protection. But so
organizations which even called it wasted chances, wasted lives. That was the European Coalition of Community Living, one of the members of this what is now the European Expert Group on Transition from Institutional to Community-Based Care. And we realized this, the investment had been largely into cosmetic changes in these institutions in Eastern European member states, because in addition to intrinsic problems that these had, they were also in very bad shape. And the fact that they were in very bad shape was used as an excuse to invest in them. And we often saw, both in the EU and sometimes in candidate countries, investment which led to embellishing the staff quarters while the children remained in horrendous conditions, or creating some facilities there, but not changing really the overall institutional, impersonal model. And this is what we set out to change with that coalition. And to cut the long story short, I think one of the results of our activism here is the adoption, is what we have in the new regulations of the structural funds, where it is really very explicit that the funds should facilitate the transition from institutional to community-based care. There's also a reference to the Convention on Rights of Persons with Disabilities, and we are really trying to put all these narratives together, not to have them in separate niches. Though of course here we are discussing children, we think it is important that there is kind of cross-fertilization between these four narratives, if you look at mental health as a separate one. And that is one success. The other one is that we have had these guidelines, to which of course Lumos made a huge contribution, the guidelines on transition from institutional to community-based care. And then of course individual organizations in our coalition have done work on this, and I would like to just highlight to you the publication on the rights of vulnerable children under the age of 3. Because if for us at the UN, the golden standard obviously is the UNCRC, the Convention on Rights of the Child. And the 2009 guidelines on alternative care of children, which are more explicit than ever before, and so is now the committee in its jurisprudence, that always there should be a preference for family type care, for supporting families. And if that is impossible, like in cases of abuse, then it should be family type, not if not the biological parents, then other family type care. And we have a former member of the committee, a gentleman from Lithuania, Dainius Puras, who wrote this for us, and I think it really sums up what how the committee has also developed. It's not static. The committee's jurisprudence itself has reflected the growing understanding of how harmful institutional care is for children, particularly here in the smallest category of children under 3. And finally, we are now in the process of doing, after having had various events with the Commission itself, and I must say we've been very grateful for the support this group was receiving, I mean, above all the political support it was receiving from the Commission. We've had Commissioner Andor and Commissioner Hahn as those who have written the foreword and supported the guidelines. And now we are doing seminars which focus on individual countries around the, let's say, eastern wing of current member states. But we do plan in the future to also look at candidate countries, but also at unfinished work that remains, let's face it, in some of the West European old member states, including the one where we are sitting now, which has surprisingly high rates of institutionalization of children, precisely because of that, I would say, old modernism, of that classical modernism, of the model of the paternalistic state which solves problems for children for families by taking children into care. And if I just have one last second, it is interesting perhaps to look at the numbers of children in care and children separated from families across individual countries. We know that there has been some research done on that, for instance by Eurochild, but the mapping is incomplete because the data are often not comparable. It's also interesting to look at the breakdown why they have been separated. And what vividly stands out in my mind is a comparison between the UK and Poland that I saw at one of these events here in the European Parliament, and I would say European Parliament is sorry Claude isn't here, is a great school for all of us. And it showed that there were 10 times as many children in Poland in institutional care per population than in the UK, while the number of those which were put in care due to violence and abuse was approximately the same, which meant that 90% of those who were there in Poland were there for different reasons. And when we got to the breakdown, it was lack of parental skills, disability of the child, disability of the parent, poverty, poor housing situation, all these reasons which in the UK today would no longer be reasons to separate the child and to put the child in care, although in the past they were. And if you look at 19th century Britain, obviously these were the reasons for which children were separated and put into care, and violence and abuse wasn't at that time. So there is a transition that needs to be done, and some of European states, I think, have by and large made it. Others are somewhere halfway, and others finally are, I would still say, in the beginning of that trajectory. And of course this is also relevant for states outside Europe. Even if they didn't create such a massive system of institutional care, perhaps it is not necessary for them to go through that stage in order to come to a truly individualized, sensitive caring system for children. They can, hopefully with the help of a global alliance, they can bypass some of that stage and bypass some of these areas. Thank you for your attention.
Yeah, and thank you so much. That was an incredible contribution, and we are so grateful to the support of the UN on this issue. It's so important, and the way everybody does work together here in Brussels, I do think is an excellent example. And we will come back to the issue of what happens in countries outside the EU, the last point that you raised, because it's a very, very important one. But what I wanted to do is to ask Andor and Kirill and Elodie if they wouldn't mind saying a few words just in terms of the sort of nuts and bolts in DG Regio and DG Employment of how you've been trying to turn these principles into practice, and how you've been working to help governments that have been doing things one way to do it in quite a different way, because I think we've got a lot to learn from that as well. So please.
Thank you very much. I will start because I have to leave at 3:30, and I just would like to really give you a very brief overview where we are with that. My name is Lumos. I'm coming from Di-Institutionalisation, and I'm responsible for social inclusion issues in regards of the use of structural funds, the regional development fund, which is used mostly for social and health infrastructure, so building schools, hospitals, social care homes, and so on. So we are in the middle of the negotiations of the new programs, and it's really high time actually to make the shift from the policy, from the legislative point of view, to make a kind of operational steps that how to implement actually all of these measures. And some of the countries, they have already identified actually the new priorities for the new programs, and we have to understand actually the barriers which member states they face, because at this stage, let's say today, the institutionalization, it should be part of the overall social care or healthcare reform, and this is one of the most important questions actually, how to find a place of the institutionalization measures in the overall policy framework of healthcare or social care reforms, because I mean you may know that structural funds are called structural just because we would like to contribute to the structural reforms. And today in the social care and healthcare we face some real difficulties because some of the systems, like for example the health system, is not affordable at this stage. So we have to find a way to make it more sustainable, more efficient, more accessible. And this question is not an easy one, because member states they are really under the pressure of some political influences, some barriers of implementing actually the reforms. So when it comes to the use of structural funds, we have to find a way, let's say, to really impose some reforms and to find a way how the institutionalization measures will be implemented in social care and healthcare. Today, in terms of money, we cannot say, of course, that how much money will be used from ERDF, from the Regional Development Fund, for this kind of actions. We just only know that in the previous programming period, which ended actually a couple of months ago, we have seen some good examples where member states, they have launched actually some activities, and colleagues, they will talk more about that. But of course, as Jan said, we have seen also some, let's say, some not so good examples, some lessons to be learned, and I would call here actually Romania, because I think this is the most well-known example, where we have seen some real difficulties actually to use well the funds and really to make the shift to the community-based care and not to refurbish or renovate actually the existing large residential institutions. The other issue which is discussed today is actually the complex use of funds, the integrated manner of using funds and the policy, because sometimes we face some difficulties of some parallel mechanisms, like what the regional fund is doing and what the social fund is doing and what other funds, let's say for example the national funds, may do. And this kind of integrated way of using the funds, this is really an important one, and that's why in the new regulations we have introduced some measures which we call multi-fund programming. So the funds should be used together, and actually they should complement each other. So what the ESF would decide, the ERDF should contribute, or in other way around, what the ERDF has identified, the ESF should contribute. This is again not an easy one, because on the programming level, just for your understanding, on the programming level, on the program level, member states, they may put together actually the funds. When it comes to the implementation, unfortunately it's not so easy, because the implementation level, it requires actually, let's say, separate cores, separate administrative systems like ESF and ERDF administrative systems, and it makes sometimes really very difficult to put together funds, and member states, they are really complaining about that. So why the European Commission is not able to solve this problem. It's, the answer is very easy, because these questions, the implementation questions, should be solved by the member states, because the implementing rules are defined by the member states and not by the Commission. So, but of course we have to work together on this issue. But this is mostly depends on the implementing rules of the member states. And the third question, and I will finish here, let's say, is that how to understand actually, let's say, the political will, the political engagement, support to these measures, because we have to be honest. Just to give you one example, I'm coming from Hungary, and I've seen some Hungarian examples. Of course, when it comes to the deinstitutionalization, there are some barriers from the community, like people, they are not really very happy when people from the disability homes are moved to your neighborhood and they are protesting. That happened in Hungary several months ago. So how to cope with this situation, how to introduce these measures, and at the same time to get the political support, the support of the local neighborhood, or even in the broad terms of the whole population. That's also a kind of barrier, and actually during the negotiations this question was raised many times. That's how to cope with this and how to use funds, and again maybe the ESF funds may help, because if we promote actually these deinstitutionalization measures like the whole program, then of using ESF funds like some promotional campaigns, then it may help to understand, let's say, the benefits for the whole population of these measures. But it's not easy. Thank you very much.
It's not easy at all, we all know that, and thank you very much, Andor, because Andor has been one of the real driving forces in DG Regio, and another of those driving forces from DG Empel is with us, Kirill. And Kirill, I wonder if you would talk, because Bulgaria was actually the first country to try to bring the Regio and employment funds together to do a joint programme on deinstitutionalisation before it was in the rules. So you helped to drive the change in regulations, and I wonder if you could just talk a little bit about some of those, successes but challenges as well.
Yes, I'll be glad to do this, but if you don't mind, I suggest Elodie. I give the floor first to Elodie, because she'll talk a little bit more from the policy perspective, why European Social Fund is investing, why for us the whole issue of deinstitutionalization is important, why we put it in the context of our anti-poverty work, and then I'll jump into Bulgarian example.
Okay, so thanks, Kirill, for doing the introduction. So I'm Elodie Fadi, I'm working in the Social Inclusion Unit in DG Employment, and I suppose, Andor has been talking really about, in particular about the ERDF, and I try to basically put it a bit more in the context of our overarching action on child poverty. So I think it's important to remind as a starting point for us that investing in children and early intervention has been a focus, an increasing focus in the field of social inclusion for a number of years already. It's very clearly driven by the increasing level of child poverty and social exclusion across Europe, because we now have about 20 million children facing poverty and social exclusion. But it's also a much longer term vision where we really came to understand much better that the earlier you intervene, the better will be the outcomes for children and for society, but also for the economy in a sense. So we, as part of this vision, we adopted last year a policy initiative for a social investment package. And as part of it, we had a specific recommendation to the member states called Investing in Children, Breaking the Cycle of Disadvantage. And it's a broad policy document which looks at a variety of policy areas to combat, to prevent child poverty, and to improve children's life chances, like income support measures, access to services like early childhood education. And for us, in a sense, it goes together, because you cannot do one without having a sort of broader and structural policies to support children and support families at the same time. And of course, within the recommendation, we put a particular focus on children in alternative care, because we've been building on the very significant progress that had been achieved in the previous years, where EU integration was really a lever for reforms. But at the same time, it was felt that there are still steps to be taken. We know that progress is too slow. We know that children are still entering institutional care in a number of member states. So the idea with this policy guidance was really to help actually delivering, supporting the reforms. So what does the recommendation say concretely? First of all, I think it was a very important emphasis on prevention. I think we've heard it today, but the idea is really to prevent as much as possible that children are removed from the family. And we know, for example, that there are lots of very good practices in terms of parenting support, child immersed, in a lot of member states, but sometimes they are more a promising approach rather than a mainstream practice. And really, this should be the starting point. And for example, early childhood education and care services can also play quite an important role in that, because early childhood is clearly a determining moment for that. It very clearly calls on the member states to stop the expansion of institutional care for children. And actually, it also underlines that children should have access to both mainstream and to specific services, quality services, in fields such as health, education, social assistance, for example. It also says that the voice of children should be listened to in the way that these services are run. I mean, sometimes it's really important for them to have this opportunity to voice their concerns. And it also puts some emphasis on a very delicate period in which children are leaving care, which is really a period where there is a very strong risk of fall into poverty and social exclusion. And it says that this is a period when you need some additional support in terms of access to education, housing, for example. And finally, the recommendation really recalls that poverty shouldn't be the justification, should never be the justification for removing a child from the family. And that's why I think this global approach, this more structural approach to addressing child poverty, to supporting families, through income support, through quality care services, is extremely important. So in our view, it should go hand in hand. You cannot touch upon one if you do not address the broader causes of child abuse and neglect to some extent. So the question is what we're doing now to implement this and to support the reforms. Clearly, we have the strategy called Europe 2020. If some of you have heard about it, it's the EU's strategy for sustainable and inclusive growth. And as part of it, we are monitoring the reform in some of the member states. Last year, Romania and Bulgaria were clearly called on stepping up efforts to reform the system. And again, many more countries got recommendation more generally related to child poverty, like the UK. Clearly, we'll tell you more about structural funds, so I won't touch upon that. But just to conclude, I would also like to highlight that we have also other programs which are within the mission. We supported, for example, some social innovation projects, which were actually looking at innovative ways to support children in the transition out of care. And obviously, some of the colleagues today might be telling you more about their action, like on social protection guidelines and issues like that. Just to finish, a very short word on enlargement countries, because I mean, also DG Employment is also engaged in the discussion with enlargement countries, and obviously the question there is a really particular challenge. So over the previous programming period, we were in charge of the human resource development component of the IPA, the instrument for pre-adhesion, and for example, Croatia had a specific project on the issue. And now we're actually launching the employment and social reform program in the candidate countries, where clearly we will look at detecting the main challenges, and the issue of alternative care will definitely be on the agenda. So that was a very short overview, but I think I will be for that.
Thank you so much. That was really helpful, and again to get that sense of the approach, the global approach that DG Employment is trying to take to this issue. So thank you so much. And Kirill, perhaps you could talk a little about the specifics in Bulgaria.
Yeah, thank you very much, Georgette. Before just touching a little bit how we do it in Bulgaria, I wanted to give you the flavor of the link between policy and structural funds.